am Dr. Malhotra, Consultant Physician Internal Medicine, AMRI Hospital, Mukundapur. Today, I'd like to focus on a few salient points about malaria and its burden on humanity. Malaria, known to us for many years, one of the oldest diseases that we know. It imposes a large burden on the world. Expected cases are around 2 million every year. Expected number of deaths, more than 600,000 as per the data in the last year. Incurring a $14 billion deficit in the budget annually. India, as we all know, is the home for malaria. Amongst the cases in Southeast Asia, more than 70% of the cases occur in India itself. And India accounts for more than 80% of the deaths that are there for malaria in Southeast Asia. Problem of malaria in India is that we do not have a very robust government program. We do not have public awareness. There is a need for robust public awareness as well as a government program to control, eliminate and eradicate malaria. Now, to do so, we must know how can malaria be prevented. Primarily, there are three ways how to prevent malaria. Firstly, vector control. Malaria is spread by the female Anopheles mosquito, which, like most mosquito-borne vector diseases, accumulates, grows and gives up larvae in stagnant water, potable water, brackish water and all water that collects in our homes and around our homes during monsoons. Larvicidal measures, sprays, dripping of kerosene on these water can help prevent malaria. However, because of the climatic changes this season and the past 2 or 3 seasons, where there have been incessant rains throughout the year, vector control measures, government undertaken vector control measures are becoming more and more difficult because it rains even in November and December and we get cases of malaria even during that time. Second way of preventing is self-prevention. We must know when there's a malaria mosquito bites. It bites generally late evenings or more so during the night. So, the age-old mosquito net is still the best measure to prevent malaria and help yourself from not getting the disease. However, having said that, migration is a big problem. Africa or other countries which do not have a good program for malaria eradication, we might have to travel to that country. Travelers from that country might bring in malaria indigenous to those countries and infect the mosquitoes in our country, and the elimination program goes for a toss. All of us are aware of the basic symptoms of malaria, but do we know that there is chemoprophylaxis for malaria? We can take a medicine, 1 tablet every week, namely chloroquine, while traveling to these endemic countries and keep on having it till we are traveling in that country and stop it once we are back in our native places. This prevents malaria from occurring while we are traveling to endemic countries. Along with the common symptoms of malaria, likely fever with high chills and rigor, there are a few atypical signs that people must be aware of. There are types of malaria commonly known as brain malaria in our parts of the country, where loss of consciousness, drowsiness, obtundation may occur. Malaria can give rise to severe pain, abdomen and vomiting. Jaundice may occur. High-colored urination due to blood in urine may also occur. These are symptoms that a person must be aware of to prevent complications of malaria. Malaria also needs to be differentiated from the other most common vector-borne disease in India, that is dengue. Dengue fever comes with a lot of body ache, a continuous fever that does not remit, unlike malaria which remits every day. The patient is somewhat better in between 2 attacks of the fever. Dengue fever is from mosquito bites during the day, while malaria fever has mosquito bites that's during the night. Both diseases may show a low platelet, but not as dramatic as dengue. Another advantage of dengue is a self-limited disease. While in malaria, we have to give some therapy in the form of chloroquine, quinine, or other newer drugs which have become essential simply because the mosquito has become smarter and malaria has become resistant in our countries. Those are known as artesunate-based medicines. Now, there have been talk about vaccine therapy for malaria. For almost 4 decades, vaccines are being developed. 30 to 40 candidate vaccines have come and gone. A recent vaccine, K21, being tried out in Ghana, is one of the most promising ones. It is produced by Serum Institute India, but there is no program for Serum Institute to test it in Indian individuals. Probably this vaccine is going to give us a fair amount of immunity for travelers and controlling and curbing this infection. The Government of India has launched a national malaria elimination program by 2030. A very good program is going on in our state also. Probably West Bengal will be malaria eliminated by 2027. Together we must, with self-awareness and participation in government programs, try and eliminate this deadly disease. However, it is totally preventable. Thank you.